Should you have a fasting blood test for stroke? When it comes to stroke, many people wonder if they need a fasting blood test to find out what's going on. The truth is, fasting blood tests are generally not used to diagnose an active stroke. Instead, stroke diagnosis mainly depends on clinical evaluation and imaging scans like computed tomography or magnetic resonance imaging. These scans give doctors a clear picture of brain injury and help determine if the stroke is caused by a blockage or bleeding. Blood tests in stroke cases are mainly used to support diagnosis and rule out other conditions. They can measure things like D-dimer, C-reactive protein, or brain natriuretic peptide, which help doctors understand the type of stroke or identify other health issues. The good news is, these tests do not usually require fasting because their results reflected ongoing processes in the body, not recent food intake. For example, measuring D-dimer can help identify blood clots, while CRP levels can indicate inflammation. These tests are quick and can be done alongside other urgent assessments. Fasting blood tests are more often used for stroke prevention rather than during an emergency. These include lipid profiles, which check cholesterol and triglyceride levels, and fasting glucose, which measures blood sugar. These tests help identify risk factors that can be managed to prevent future strokes. Because they need to be accurate, they are usually done after fasting for at least 8 hours, but this is part of long-term health planning, not immediate stroke diagnosis. In summary, if you are having a stroke, you should not expect a fasting blood test to be part of your initial diagnosis. Blood tests that support stroke diagnosis do not require fasting and are used to complement imaging and clinical exams. Fasting blood tests are more relevant for assessing your overall cardiovascular health and stroke risk factors, which can be checked later. Always follow your healthcare provider's advice about which tests are appropriate for your situation. Remember, quick imaging and clinical assessment remains the cornerstone of stroke diagnosis, with blood tests playing a supportive role in understanding your health and preventing future events.